And here with answers to your medical questions in our Ask the Doc segment is Dr. Msonthi Levine. Okay, so other than children watching Live at 5 and the news, what should they watch?
Barney, things like that.
I'm just teasing.
Yeah, I mean, we always talk about just the amount of TV exposure that kids have. We've talked about it many times. Obviously, we know things that are on TV can influence children's behavior as well as adults' behavior, but we can't live in a bubble, obviously, and you have to be engaged, you have to become part of society, and unfortunately Americans watch TV, so you just have to be aware, be involved as a parent, make sure you're there for your kids to answer any questions that they might have about
Don't use television as a babysitter?
Absolutely, but it's difficult for a lot of the families out there. They have a lot of different responsibilities. They can't be with the kids all day long, but I've just found that parents who are involved with their kids typically have a really good outcome, just making sure the kids know what they're seeing on TV. Certainly try to limit violence and the trashy type of TV. And don't forget the internet. A lot of people are not watching TV anymore. They're on the internet a lot, and so you have to be cautious of the computer and the internet. A lot of dangerous things on the internet, so just be involved with your kids. Explain to them what they're seeing, and I think for the most part that will work out. There's always dangers out there, but we cannot live in a bubble. We have to live our lives.
So don't go out and sell your TVs.
I would not do that. It just it just highlights that fact that those things are dangerous, and you just have to be involved and educate your kids.
All right, on to some of our viewers' medical questions. This person wants to know, why are there no more doctors in this area allowing VBACs, vaginal birth after cesarean?
I'm not quite sure. Don't do a lot of vaginal gynecology or obstetrics. I probably have to talk with my colleagues about that. Probably has to do with just the risk of that type of procedure or new techniques that are available to people who are pregnant, but actually I don't know the reason for that.
Okay, another question. I have severe psoriasis in my scalp. Are there any shampoos that could help?
Typically we do a steroid shampoo. Normally has to be prescription because of its potency and potential for complications and side effects. If the shampoos don't work, there's other topical medicines, oral medicines, ultraviolet light, a whole host of things. Certainly get with your dermatologist.
Okay. My husband for the last week has had a problem with his throat. It feels scratchy and irritated, so he grabs a cough drop, but then he complains of having cotton mouth and feels like there is something in his throat and constantly has to swallow. What could it possibly be?
Some things would be a viral infection. That's big time this time of year. A bacterial infection. Doesn't sound like that because it's fairly mild. Acid reflux can cause a lot of throat pain. If this person was a smoker or chewed tobacco, it could be malignancy or cancer. The bottom line is, because it has persisted, he needs a good evaluation by his primary care physician. Ear, nose, and throat doctors have instruments where they can go down and look in the throat and the vocal cords, so that's certainly what I would recommend.
Okay. What can I do to help get rid of a sinus infection without going to the doctor? I always say stay stuffed up on my right side.
Well, most of the time the infections are not really infections. It could just be allergies. This is a big problem in this area. Chemical plants, the trees in the air. A lot of times antihistamines work very well. Over-the-counter, Benadryl, Claritin, to name a few. There's some steroid nasal sprays. That's prescription, unfortunately. So I would try the over-the-counter antihistamines first.
All right, Dr. Levine, we've got lots of other questions, so don't go away. Dr. Levine will answer more of your questions next on Live at 5. We're back with Dr. Msonthi Levine to answer more of your medical questions. Okay, Dr. Levine, I have to admit, our camera guy, our floor director,
yes,
he is suffering from a Girl Scout cookie crash.
Okay.
How does he get over it?
A lot of times the crashes are related to either low sugar or high sugar.
I think it's high sugar in this
high sugar.
instance.
Insulin is really the only thing that can do that. We use that Novolog, a regular insulin that works really fast. A lot of times patients will have what we call a sliding scale insulin that works very well. So we'll have them take so much insulin depending on the amount of the blood sugar reading. So certainly that's what I would recommend.
All right. There you have it.
Absolutely.
Okay, another one. This person was diagnosed with a bladder infection. They were given Rocephin and clindamycin. How long will it take to clear it up?
Normally should be in a day or two. Clindamycin, Rocephin, 2 good antibiotics they give in the emergency department. Normally we send them home on some tablets that they can take, either Bactrim or Macrobid. So it should be in a couple of days. If it hasn't gotten better, certainly I would get back to their primary care physician for a repeat evaluation to see if it truly is an infection. It may be something different.
Okay, every now and then there's a lot of blood in my stool, and this person also suffers with severe stomach pain. Is that a problem?
Absolutely. Anytime you're bleeding in your stool, that's something to be concerned about. Certainly anal hemorrhoids is a very common cause of blood in the stool, but it could be what we call inflammatory bowel disease, such as Crohn's or ulcerative colitis. So certainly if you're bleeding, it needs to be checked out with an endoscopic evaluation, especially if you're having abdominal cramping. That's one of those red flags that we talk about, including fever and loss of appetite.
Okay. This person says their big toes on both feet have cramps in it. What could it be?
You know, we talk about cramps a lot. A lot of times it's from medication, such as diuretics. Sometimes the cholesterol medications can cause that. So a lot of times we have to look at the medication profile. Some over-the-counter medication that works really well for that. We certainly would check your blood work, make sure you're not thyroid deficient, don't have diabetes, so certainly we can get that fixed.
Okay. How do you treat hypoglycemia?
Hypoglycemia is just low blood sugar, and normally we have patients take sugar basically, whether it be in the form of candy or juice. Coca-Cola works very well. Fruit works very well. Normally we have them have something on in order. The blood sugar gets low, they can take it immediately, so they don't have to worry about that.
Okay. This person is a 39-year-old female with hot and cold flashes and hair loss. They had their thyroid removed in July of 2012. They just had their levels checked and all are good, but they feel like they're losing their mind. They're miserable. Could they be going through menopause, or is this because they had their thyroid removed?
I certainly would check the thyroid. It causes so many different issues in the body. That's a simple blood test. Menopause at 39 is a little bit young, but it can happen. Certainly just need a good physical evaluation and blood workup. Certainly we have medicines for both of those disorders.
Okay, this person has high blood pressure and a severe sinus infection. They can't seem to find an over-the-counter sinus medicine that doesn't make their blood pressure go up. Is there any that they could take that wouldn't make their blood pressure go up?
You just have to avoid the decongestants, which are in a lot of the cold and flu medications. The antihistamine should be okay. Chlorcidin is a very common over-the-counter product that works really well. A lot of times you need antibiotics or some steroids, so certainly if it's progressing and it won't go away, just get to your doctor for some prescription medications.
All right, Dr. Levine, as always, we appreciate you stopping
Yes,
by.
ma'am.
And you can always visit our website and see the answers to these and other medical questions posted online. And if you'd like to have Dr. Levine answer your medical question, you can always mail us at the address listed on your screen. You can fax us at 892-7305, email us at laf@kfdm.com, or you can post those questions every Monday on our KFDM News Facebook page.